Hi, welcome. I'm Dr. Ryan Sultan. I'm a faculty member at Columbia University, Professor of Clinical Psychiatry, and I'm also the Medical Director of Integrative Psychiatry. One of the things that has happened in the last few decades is that we've realized that ADHD is more complicated than we thought it was. We used to think that it was more rare than it was. We used to think it was mostly in boys, and we used to think that you kind of always outgrew it. And it turns out that it's not just a childhood diagnosis. It's a diagnosis that will continue to show up. In fact, most individuals will have some symptoms into adulthood. We also realize that while it affects people academically, it also has bigger, longer-term concerns, such as issues with the law. I want to talk about a new paper that just came out in JAMA Psychiatry, and it has some really important findings. It looks at ADHD and some of the changes we've seen in ADHD as we've expanded the number of people that have been treated. What they found on a population level was that you get a reduction in the risk of particularly car accidents and trouble with the law. But what they noticed was that as you treated a larger and larger population, the effect that you saw started to decrease. There was this big reduction for that first group. That group of people that were the core ADHD individuals, but these older individuals that we're treating later, these female individuals, we don't see as much of a reduction, and we can't figure out why. It's because their risk for the car accident, their risk for self-harm, their risk for having a legal problem was much lower to start out with than the original group of more severe ADHD individuals. You have to think about it from the point of view of when we diagnose a medical condition and we first identify it, there are these really big fish that are just there, and you just notice them. These are people with very severe symptoms. They might have had symptoms in preschool. And then there are individuals that maybe have less severe symptoms. They're not likely to show up until later in life, or rather they're not put in a situation where those symptoms are visible. So when you treat those individuals, you're not likely to see this reduction in these events. But there is an advantage to their treatment, right? Because we also know that ADHD treatment affects quality of life for people with ADHD. So their interpersonal relationships are better because they're able to read social cues more easily when they receive their treatment. Their likelihood of having depression is going to go down. Their likelihood of having anxiety is going to go down because those symptoms are often reactions to problems that have occurred from their untreated ADHD. There's been a lot of discussion recently around psychiatric diagnoses and the appropriateness of those diagnoses and why the rates are going up. And I always get nervous when people talk about that and they are critical of psychiatry because it often has a negative impact on our patient population. How does it have a negative impact? Well, people start to think, maybe I shouldn't take my medication. Maybe I don't have this diagnosis, maybe I don't actually need this kind of help. And that's problematic because we know for ADHD that treatment is the difference between increased risk of suicidal ideation and not, increased risk of depression and not. All right, I hope this has been really helpful for you guys understanding these findings. I always encourage you to look at the primary literature. Don't take my word for it. Look at this paper up in JAMA Psychiatry. If you're interested in treatment and you are in one of the states that we are licensed for ADHD, we have an integrative approach and we pull from the scientific data, much like this paper that we're talking about, and we also are going to use a variety of different treatments because a multi-pronged approach is going to be the most effective approach for people with any mental health condition, particularly ADHD. You can reach out. Here's our website,